and maybe good evening to some of you. My name is Rubkat Nafu, and I am the founder and CEO of R&D Associates here in Baltimore, and also RDA Africa, located headquartered in Addis Ababa, Ethiopia. And I'm also at Johns Hopkins School of Medicine. It is a pleasure to welcome you to our webinar series on vaccine hesitancy in Africa, along with my colleagues at ANADEC Group. So this is the first of the series, and the intent of this series is actually to have honest conversation about what is impeding vaccination of populations in Africa. It is a conversation that needs to happen on a parallel path while we are also pushing ahead with opportunities to have our population vaccinated and access the COVID vaccine. Only 2% of COVID vaccines have been administered in Africa. There are about 2.7 billion vaccines administered globally, and yet we have only 2% administered in Africa. Some African countries are faring a bit better than others. There are various groups that are advocating on behalf of Africa to make vaccines affordable and to also to provide opportunities for us to produce vaccines so that it will be more cost and efficient. There are 30 countries that have less than 5% of the single dose administered, and there are about 4% of Africans are fully vaccinated. That's a very, very low number. In some cases, as I said, 2%. What this conversation is a series of conversations to encourage discussion wherever you may be, and you all take on the responsibility to share information that is shared here so that we can address head-on vaccine hesitancy in Africa. So when we think about hesitancy, there are several factors, and those factors are going to be discussed by the panelists that we have here. But we encourage the audience that's here to ask your questions, not speak up, but actually send your questions through the chat, and we will have your questions answered. If there are time limitations and we don't get a chance to answer your questions on this webinar, we will definitely respond to them either via email to you or post the responses on either ANADEC Group's website or RD's website, or send it out with the conference summary, with the symposium summary. This conversation is not only relevant to the continent of Africa, it's a conversation that's relevant to the globe. Every country really should take on this conversation about vaccine hesitancy, because it does happen even in the most industrialized and most developed countries with immense access to vaccines. So having vaccines available doesn't quite equate to taking on vaccines, whether you're in Africa, or whether in the continent of Europe, whether you're in the US. So please pay attention to this conversation and take ownership about your role wherever you may be to lead or partner with us in this effort to address vaccine hesitancy globally, but more specifically in Africa. The kind of challenges we're facing is similar to the challenges that we have faced with polio vaccines, and look how far we've come with polio. Currently in the US, there's a strong push for HPV vaccine, and we are facing challenges because of lack of awareness that it is available, but also because of challenges regarding all kinds of myths and conspiracy theories and discomfort with the vaccine. So what this webinar series is and what it is not, it is about having welcoming a session with tremendous experts here that we have here to answer questions. It is a conversation that is globally relevant. It is a conversation that's going to be honest and non-judgmental. It is an opportunity to ask your questions and have them answered, and for you to take on the responsibility to share information with others. This is not a judgmental conversation. This is not an academic conversation. This is a conversation with everyone. So I want to make that clear. So without further ado, I'm going to turn things over to my colleague who has been really working diligently on this effort. Dr. Egby, I turn things over to you.
Okay. Thank you, Repka. So thank you very much for people who've joined us for this first webinar. And one of the reasons why we decided to do the webinar is that we've been running a COVID vaccine survey across Africa over the last few months. And last time I looked at it and I think we had responses from about 15 countries. About 20 to 25% of the people had indicated they had not taken the vaccine deliberately because they were hesitant or they were worried about its side effects. And there's been a lot of conversations on issues of supplies supply or increasing the supply of vaccines in Africa, but less conversation, on vaccine hesitancy, and so that was what we were trying to do. And this first is actually focusing on healthcare providers, but there'll be different sections focusing on different stakeholders. And so just to remind you what vaccines, the vaccines we're talking about, Jamie, please can you put up the slide? So, yeah. So I want to remind you what vaccines we're talking about. In most African countries, the most predominant vaccine was AstraZeneca, partly because for many folks, it was initially from COVAX. And, okay, next, yeah. Thank you. Can you share the stuff? So this was just to remind you of the vaccines. So basically the major vaccine in many countries in Africa has been AstraZeneca. And one of the key issues people often talk about all the vaccines do have side effects, but generally it looks like the side effects are much less than the benefit of having the vaccines. And this was a little slide that came up from the African Union during the conversations around J&J. And just to remind you that one of the issues were clots, and if you look at the birth pill or people who smoke, and smoking is increasing on the continent, you're much more likely to have a clot, either due to taking the birth control pill or smoking. And so, so this slide was just to remind you, so some of you may have or have heard of Pfizer or Moderna, which are both RNA vaccines, and you have to take two. The AstraZeneca, which is common, and I just mentioned, which you have to take two vaccines. And so almost all the others, or Sputnik, which is the Russian vaccine and has been taken in some countries, or either of the Chinese vaccine, Corona or Sinopharm, was all sorts of two vaccines. And the only single vaccine was J&J, but it's similar to AstraZeneca. Next slide, please. And just to remind you, one of the conversations about a lot of vaccines has really been, they all came, completely new. And just, and I'm sure the speakers will talk about it. But for example, the AstraZeneca and J&J vaccine and Sputnik is sort of similar to the technology used in the Ebola vaccine, which has been used in DRC very successfully. And then you have, vaccines, like Novavax, which is about to be approved for phase 3, is applied for its EUA in the US, or about to apply for the EUA, is similar to the technology used in hepatitis. And for both Moderna and Pfizer, since, I mean, there had been significant research on this, and since the use in Moderna and Pfizer, this technology has been applied to a host of other diseases. And so that's just, so this was just to remind you, these are the vaccines we're talking about, and these are generally the vaccines in the market. If people are aware of any other vaccine or have taken any other vaccine that's different from what's on the list, please put it in the chat. And so maybe we can discuss that too. Thank you. And can we put up the first question of the poll, Jamie, please? Thank you. Okay. Jamie, are you able to put up the poll? Okay. If not, I have the great pleasure of welcoming Dr. Kechi Achebe, who is the Director of HIV and Health at the Peace Corps and a member of the COVID-19 task force in the US. Kechi, before her senior government role, had worked extensively in Africa and other emerging markets on public health issues, especially on HIV/AIDS, Kechi has a long career both in delivering healthcare in several countries, but in policy and on project development for more than 25 years. She's worked with the largest institutions in the world in public health, including the Global Fund for HIV/AIDS and TB. And so she has very strong understanding of the international global health space, and now is a senior member in the US government health space. And Dr. Achebe, we're delighted to have you on board. Happy to hand over to you. Thank you.
Thank you so much, Dr. Iwe. Good morning, good afternoon, and I would also say good evening to those calling from I would say Asia and probably Australia. So we're really delighted to have you here. Just for you to know, Jamie has put on the poll, and I see that several of you have answered. Only about 47% of you have answered. So please, if you can take the next 1 minute, I will pause for a minute for you to respond to the poll. The first question says, are you a healthcare worker? And if yes, just click on your response. The second question says, are you vaccinated against COVID? This is just a poll. There's no name attached to it. And the third question says, if you're not vaccinated against COVID, why? And there are several, drop downs for you to choose from. And the fourth question says, have you lost any healthcare worker colleague to COVID? There's a single choice of yes and no. And our last and final question says, have you lost any loved ones or anyone you knew personally to COVID-19? It's also a choice of yes and no. So thank you. I see number 5, everyone has answered. Number 4, we have 100% have answered. Number 3, we are at 100% that has answered. Number 2, the same, and number 1, the same. So Jamie, I think we're good to go with the poll, and thank you to all the participants for your response. So are you going to share the results with us? So I think you'll be doing that, but just for time management, I'm going to go into a panel of today. So again, thank you all for being here. And this is going to be a very, important and I think engaging conversation because, we know that the vaccination is a preventive measure, And once, if